This is since how long?
This back pain now, I think for 3 months.
Is it increasing by activity?
Yes, activities make it worse.
Which part of your back?
All over my back.
Is it going to your legs?
No,
If I will tell out of 10 how much you can scale it,
maybe 4.
it increased with activity, you said, and is it getting better with rest?
Yes.
Okay, right. Do you have any skin changes?
Skin changes, nothing specific.
Any mouth sores?
No,
Any alteration of your bowel habit?
my bowel is okay.
Any water work changes in terms
Yes,
of color,
yes, yes. My water work decreased in amount recently and it's becoming darker.
This is since how long?
This is now maybe 3 weeks or so.
Okay, and what do you mean by darker? Is it blood color or it's more dark?
More dark.
Is it painful as well?
No,
Is there any tummy swelling?
no,
Okay, tummy pain?
no,
Okay, did you pass any gravels?
no,
Okay, and do you feel you're drinking a lot of water as well?
no.
Okay, and did you have did you ever diagnose with any health condition?
Yes, I have been diagnosed with diabetes 20 years ago and I'm on insulin and it's more or less controlled.
How much is the last HbA1c?
7.
Okay, right. Do you take insulin? Did you change the dose of insulin?
No, no, no.
And you're compliant to the medicine?
Yes.
Any other health condition I should be aware?
No, nothing.
Any medication
No,
apart from insulin?
nothing.
Sorry to ask, any illicit drugs?
No,
Any history of hospitalization before?
no,
Any blood transfusion?
no,
Sharing needles?
no.
And what do you do for living?
I'm retired.
How is the things affecting your daily activity?
Fatigue, doctor. Fatigued most of the day.
I am very sorry really to hear this. And do you have any family history of cancer?
No,
Family history, if not, I should be aware.
no,
Do you smoke?
no,
You drink alcohol?
no.
Okay. Um, may I examine you?
Yes,
And
please.
meanwhile, I might need to ask you questions.
Yes, please.
What I understood from you is that you have been tired and you're losing weight
Yes,
and you have fever
yes,
and you have back pain as
yes.
well and you have kidney problem.
I have, yes,
Mm.
problem with my water work. Yes,
Okay, I'm very sorry to hear this. May I
yes.
examine the patient? How is the vital signs?
Vitals is okay.
Is the patient looks pale,
Yes,
jaundiced,
no,
any mouth sores?
no.
Okay, I need to examine first the patient. If there is any lymph nodes in the neck.
Examine, doctor. No lymph node.
Okay, I need to examine the back. Where is the
Examine
tenderness exactly?
all over the back. You can palpate, and there is tenderness.
Okay, any deformity?
No.
I will ask the patient to do movement. He can do
Yes,
active
yes,
movement.
yes, yes,
Okay, then I need to examine the patient, let him lie down flat, and I need to examine his abdomen.
yes. Examine, doctor. What do you want to examine?
Is there is any palpable mass?
No,
Is there any tenderness?
no.
Okay, right. Okay, and I need to examine for the patient legs. Is the leg rising test is positive?
No.
Okay, Mr. Ali, did you travel recently?
Travel? No.
Okay, I'm sorry to ask you, do you have a partner?
I'm a widow doctor. My wife passed away.
I'm very sorry for this. Okay, I need to examine for the pallor for okay, lower limb. Is there any swelling?
No.
Okay. I need to examine the cardiovascular system.
Some.
Any murmur?
No.
Okay. I need to examine for axillary lymph node also.
You examined for lymph node, and lymph node is okay. Okay,
Okay.
2 minutes
Mr.
left.
Ali, okay. May I ask you what is your
My
concern?
concern about this fatigability, doctor, could be related to the fever, what I have.
May I ask you, do you have any cough
For now, no.
before you were having?
Sometimes with the
A-
fever attacks.
Any chest pain?
No, no,
Awareness of heartbeat?
no.
Okay. Your concern is very valid, Mr. Ali. I'm just afraid that you might have blood disease,
Okay,
which we call it multiple myeloma.
okay,
It's a problem in the in the blood factory in your
okay,
body,
okay,
which give abnormal blood cells,
okay,
and unfortunately this lead to recurrent infection, lead to back pain, and it can also lead to urine issue as well, or water work issue.
okay.
So what we need to do now, we need to admit you, and we need to do urgent investigation for you
Hmm.
in this form of blood test as well as imaging.
Okay,
And we will do multidisciplinary team from the blood doctor, from the kidney doctor, from the bone doctor,
okay,
and we will come back to you, update you with the result. Do you
okay.
have any other concern?
No, doctor, thank you. Now, discussion with the examiner. Present your positive finding, please.
Mr. Ali, 60 years old, presented with fatigue as well as weight loss, loss of appetite, and he looks pale. And he give history also of back pain as well as some reduced urine output.
Okay,
On examination, he looks pale, he's having tenderness on his spine, and other apart from this, nothing remarkable.
okay,
Putting the age of Mr. Ali, 60 years old, with recurrent infection, with anemia, with back pain, with water work changes, it's very important to rule out multiple myeloma.
okay.
However, other malignancies need to be ruled out.
What type of malignancies?
Uh, any malignancy which can give metastasis, maybe colorectal malignancy, maybe renal cell carcinoma, since he's having some water work issue.
Okay,
Um,
okay.
but
Any other
mainly is
blood
this
malignancies?
can be leukemia, can
Which
be
type?
my, can be myeloproliferative disorder. I think CML.
Okay, very good. Very good. Anything else?
Uh, um, anything else which malignancy you mean?
Cause this fatigability, maybe?
Yes. Um, it's very important to rule out other causes like apart from malignancy, maybe anemia itself gives this. However, he's having
Yes.
red flags.
Yes, you mentioned about
Yeah,
something affecting the kidneys itself.
yeah,
Yes, could
may,
be renal failure or something.
maybe, maybe renal failure. Yes, maybe renal failure.
Okay. Did you palpate for the kidneys?
Yes, I ask any organomegaly.
Okay. Any signs of renal failure in this patient?
I'm not sure.
Okay. So if this patient is multiple myeloma, how would you like to investigate?
We need to do full blood count to see the hemoglobin level,
Okay.
as well as we need also to do serum calcium,
Okay.
kidney function test. We might need to do imaging. We need also to do imaging of the spine for any bone lytic lesion.
Okay.
And we need also to do inflammatory markers. We need to do serum protein electrophoresis,
Okay.
as well as urine protein electrophoresis.
Okay.
And we might need to do PET scan. We might need to do also bone marrow aspirate and biopsy.
Okay. What do you search in this bone marrow?
For abnormal plasma cells,
Okay. Do you know what percentage you expect?
If more than 10,
Yes, it's more than 10 or 10 to 30%. 30% may be a major criteria. Okay, so what types of immunoglobulins you expect in the protein electrophoresis to be rising?
monoglobulin IgG,
Okay,
monoclonal IgG,
IgG
or IgA,
and IgA. What types of protein you expect to see in the urine?
Benz-Jones protein.
Benz-Jones protein and the light chain of immunoglobulin M.
Okay,
Okay,
light chain.
okay. So, what complication you expect from this multiple myeloma? You need to search for
Hypercalcemia, anemia,
hypercalcemia. Okay,
renal impairment,
and
bone lesion,
bony lesion. How would you
fracture.
like? Yes, how would you like to solve each? Could hypercalcemia present with this fatigability?
Can be, but again, is this patient that doesn't have any polydipsia,
Okay, okay. So,
doesn't have
if
any heart motion.
yes, if the calcium level of this patient is 19, how would you like to deal?
Urgent ECG,
Okay,
normal saline,
fluid,
as well
yes,
as we need to um, calcium. Um, I forgot the name of the medicine.
calcitonin,
Calcitonin.
yes, for the hypercalcemia.
calcitonin.
Yes, on
Mhm.
stabilizing, yes,
ايوه
yes,
صح.
yes.
ايوه صح.
Continue,
ايوه كده.
continue. So you need
And
to start this patient on fluid. What other?
yes, fluid.
Yes, what other?
And we need to protect his heart.
Mm,
Uh,
this is more with hyperkalemia. I'm asking about hypercalcemia management in this patient. So we need to
mm,
start this patient on fluid, diuretics, and add calcitonin. Calcitonin will work in 4 to 6 hours to stabilize the bone and prevent more resorption of the calcium. Followed by bisphosphonate. Bisphosphonate, we have pamidronate, IV pamidronate, which can work in
mm,
48 hours. We have also zoledronic acid, which work in 1 week,
mm.
and prednisolone. Sometimes we
ما
can
يعني
add
هو ده this is the treatment for
for
hypercalcemia overall.
hypercalcemia with METs, hypercalcemia with multiple myeloma, any acute hypercalcemia
Oh.
treated this way. We need also to start
Mm.
him on denosumab to stop this osteoporosis process added to
Okay.
the bisphosphonate. Okay?
أيوة
Okay.
okay.
So
Mhm.
fluid diuretics, calcitonin, IV bisphosphonate, and denosumab. How would you like to treat multiple myeloma?
Um, multiple myeloma, I think the main core of treatment is bone marrow transplantation,
Okay, any other treatment?
chemotherapy.
Okay. Okay, so the main lines of treatment of multiple myeloma is first monoclonal antibody called
Mm.
bortezomib, chemotherapy, the
Mhm.
thalidomide, and dexamethasone. And there is also bone marrow transplant. Okay, what is the prognostic test for multiple myeloma?
Uh, I'm
LD,
not sure really.
LDH, and beta 2 microglobulin. Okay, and this is the same as
Mm.
CML, chronic myeloid leukemia. Okay, thank you, doctor.